So tonight we're taking a closer look at Missouri as the state leads the nation in the rate of new COVID-19 cases. 41 Action's reporter Emma James talked with Kansas City hospital leaders about what this could mean for the metro.
Dr. Mark Steele, Chief Clinical Officer here at Truman Medical Center's University Health, says it didn't feel great to see Missouri leading the nation in new COVID-19 cases because it's something that's completely preventable.
I mean, there's no question that where we're seeing outbreaks is in areas where there's a lower vaccination rate. And so it's really unvaccinated population that's at risk for developing COVID.
Dr. Steele says Missouri's recent spike in COVID-19 cases brings some concern about a rise in cases in the metro. The good news for Kansas City, though, he says.
In the urban areas, we know that the vaccination rates are higher than the rural areas, so we hopefully have an additional layer of protection.
Among the state's recent COVID outbreaks in the northwest and southwest regions, the Delta variant is becoming more dominant. Health officials say it's been proven to be even more contagious and possibly even more deadly than others. They continue to point to vaccines as key protection.
And remember, the other reason for vaccination is that it helps protect others because you tend not to spread the disease as much. And by having a vaccine, the virus is less likely to reproduce a lot inside of us and therefore create variants.
Steele says Truman Medical Center's University Health is launching new initiatives to get those vaccinated who aren't yet. He worries recent outbreaks will only continue if the state doesn't increase its vaccination rate.
And we know that these vaccines are so highly efficacious and very, very safe. And so there just really is no good reason not for people to get the vaccine, protect themselves, protect their families, protect their loved ones, particularly those who are unvaccinated.
In Kansas City, Emma James, 41 Action News.
41 Action News asked the Missouri Department of Health and Senior Services about the rise in cases in portions of the metro. A spokesperson said the department is monitoring the situation and noted vaccinations are the most effective means of battling COVID-19 transmission. In fact, in a statement, the spokesperson wrote this: "At this current phase, we are working in more targeted efforts engaging businesses, employers, schools, and churches to provide vaccination opportunities in their communities. We're also engaged in a targeted and aggressive state public education effort, encouraging those Missourians not yet vaccinated to do so."
In our area, the positivity rate is still low. For the first half of June, according to the Mid-America Regional Council, the 14-day average of positive cases was under 5%. The daily average of new cases was the lowest at any point this year, but it comes with a catch. Testing for COVID-19 has dropped dramatically. The Mid-America Regional Council believes the daily average of tests should be 3,150. Well, the metro hasn't hit that benchmark since early February, and testing for the first half of this month is less than 50% of the recommended testing rate. In a risk assessment by the Mid-America Regional Council, the group noted, quote, "With this low level of testing, it's difficult to understand the prevalence of the disease in this community."